Healthcare affordability in the United States isn't for the faint of heart anymore. For many retirees, a routine doctor's visit, prescription medication, or unexpected medical emergency can cost far more than expected. And the hard truth is that even a lifetime of savings can disappear much faster than you think when healthcare bills start piling up. That's one of the biggest reasons why more retirees are looking beyond the US and exploring retirement destinations abroad. But here's the challenge: not every country that looks affordable on paper offers the quality healthcare you may need later in life. A country may be affordable, beautiful, and welcoming, but if the healthcare system isn't reliable, it could turn your dream retirement into a costly mistake. So how do you find a country where you can enjoy your retirement years without constantly worrying about healthcare costs or the quality of care you'll receive when you need it most? In this video, I'll reveal 8 countries that offer world-class healthcare, excellent medical facilities, and significantly lower healthcare costs than many retirees are used to in the United States. Some of these countries may even surprise you. So before you decide where to spend your golden years, make sure you watch until the end, because the country that ranks number 1 could save you thousands of dollars while giving you access to some of the best healthcare in the world. Now, let's get started. 8. Panama. Panama operates a dual healthcare system, public and private, but for most American expats, the private sector is where the magic happens. Hospitals like Petilla, San Fernando, and Pacifica Salud are affordable, modern, and incredibly efficient, and many are affiliated with distinguished organizations like Joint Commission International or the Cleveland Clinic. Many doctors speak English and have been trained in the US, so you won't be left guessing when discussing your health. And here's what really gets people excited: waiting times in the private sector are extremely short. In many cases, surgery can be scheduled within a day or two. Compare that to the weeks or months you might wait back home. Many people report their treatment in Panama comes in at around 10% of the US cost. A dental crown that could cost you between $1,000 and $3,500 in the States. About $580 in Panama. Private health insurance in Panama costs less than half of what you'd pay in the United States. And because Panama is a dollar-based economy, US citizens won't need to worry about currency exchange. Panama's life expectancy sits right around 80 years as of 2025, a strong signal that this healthcare system is genuinely keeping its population healthy over the long haul. It's worth taking note of the trade-offs though. The public system can have longer wait times, and healthcare access in rural areas is more limited. For retirees over 70, getting private health insurance can be more challenging, though options do exist, so it's worth researching before you commit. On the residency side, Panama's famous Pensionado visa is one of the easiest in the world. It grants permanent residency and only requires a lifetime pension or annuity of at least $1,000 per month. Panama's renowned Pensionado program gives Pensionado holders legally mandated discounts on medicines, restaurants, utilities, airline tickets, hotels, and entertainment. As for lifestyle, Panama delivers a stunning mix of tropical beaches, cool mountain towns like Boquete, and a buzzing cosmopolitan Panama City. Most retirees live comfortably on just $2,000 to $3,000 per month. It's affordable, vibrant, and offers an excellent quality of life. 7. Costa Rica. Costa Rica runs a dual healthcare system, public and private, and both deserve your attention. The public system, known as the CAJA or CCSS, has been around since the 1940s and offers universal coverage to every legal resident. Once you have residency, you're enrolled in a system that covers doctor visits, hospital stays, surgeries, lab work, emergency care, and prescriptions, all with no deductibles and no co-pays. Monthly contributions run between just $70 and $220 depending on your declared income. The CAJA is exceptional for emergencies and routine care, but here's the honest trade-off: specialist wait times in the public system can stretch anywhere from 3 to 6 months. That's where private healthcare fills the gap beautifully. A private doctor visit runs just $50 to $80, a specialist consultation is $80 to $150, and comprehensive private insurance plans range from $150 to $400 per month. Private hospitals like Shima Hospital and Clinica Biblica in San Jose offer US-level care with English-speaking doctors at a fraction of American prices. Most American expats use both systems, the Kaja as the foundation and private coverage to cut the wait times. On the dental side, a crown that costs $1,000 to $1,500 back home will run you just $300 to $500 here. Costa Rica's life expectancy sits at around 80.3 years, rivaling the United States and Canada, which says a lot about a healthcare system that genuinely delivers for its people over the long haul. On the residency side, Costa Rica's Pensionado visa is refreshingly straightforward. You need just $1,000 per month in lifetime pension income. U.S. Social Security fully qualifies, with no minimum age requirement and no investment needed. The process typically takes around 18 months. As for lifestyle, Costa Rica is stunning. Pacific and Caribbean coastlines, cloud forests, volcanoes, and year-round outdoor living. It ranks 54th on the 2025 Global Peace Index, one of the safest countries in all of Latin America. Most retirees live very comfortably on $2,500 a month in popular expat areas, or as little as $1,600 inland. Pura vida isn't just a saying, it's genuinely the way of life here. 6. Malaysia. If you want world-class hospitals at a fraction of American prices, with doctors trained in the US, the UK, and Australia, all speaking English, Malaysia might just be one of the most underrated retirement destinations on the entire list. Malaysia runs a dual healthcare system, public and private, but the real story for retirees is in the private sector, and it is genuinely outstanding. Hospitals like Gleneagles Kuala Lumpur, Prince Court Medical Center, Sunway Medical Center, and Penang Adventist Hospital offer hotel-like facilities packed with cutting-edge technology and internationally trained specialists. Over 13 of Malaysia's private hospitals hold Joint Commission International Accreditation, the global gold standard of healthcare quality. And here's something that will surprise most Americans: you don't need a referral to see a specialist. You simply walk in, register, and wait. In most cases, wait times are extremely short. A specialist consultation costs around $30 for an initial visit, and follow-up visits are often included at no extra charge. A GP visit at a local clinic runs as little as $5. Comprehensive private health insurance for retirees in their 60s runs roughly $68 to $180 per month, a fraction of what you'd pay back in the States. It's no surprise that Malaysia attracted 1.52 million medical tourists in 2024, generating substantial revenue and reinforcing its position as one of Asia's premier healthcare destinations. Malaysia's life expectancy sits at approximately 76 years, and with the government's ambitious 2023 Health White Paper, a 15-year roadmap to transform the healthcare system toward preventive care, backed by a 2026 health budget of approximately $11.4 billion, the system is actively growing and modernizing. The trade-offs are worth knowing up front. The public system can be crowded and is primarily designed for Malaysian citizens. Mental health services are less developed compared to physical healthcare. Insurance for pre-existing conditions can be expensive or unavailable, and it gets significantly harder to secure coverage after age 65 to 70, so getting insured early is a smart move. On the residency side, Malaysia's MM2H, Malaysia My Second Home, program is well known, but its financial bar is higher than most countries. The silver tier requires a fixed deposit of $150,000 and a minimum property purchase of $600,000, with a renewable 5-year stay. The upside? Zero tax on foreign income, U.S. Social Security and pensions are fully exempt. As for lifestyle, Malaysia absolutely delivers. Kuala Lumpur is a vibrant, cosmopolitan city with world-class dining and entertainment. Penang is a UNESCO-listed cultural gem and food paradise. Malaysia ranks 24th out of 123 nations on the 2025 English Proficiency Index, making daily life remarkably easy for Americans. A comfortable retirement typically runs $2,500 to $3,500 per month. 5. Italy. Italy's public healthcare system, called the Servizio Sanitario Nazionale, or SSN, is a universal system built on a simple principle: every legal resident deserves access to quality care. As a non-EU retiree, you can voluntarily register with the SSN for a minimum annual contribution of around $2,200. That gives you access to hospital care, GP visits, specialist referrals, emergency services, vaccinations, diagnostic tests, and a wide range of prescriptions, all either free or for a modest copayment that typically ranges between just €16 and €50. And if you want faster, more flexible access, private health insurance in Italy runs between just €800 and €2,000 per year in 2026, a number that will make most Americans do a double take. Italy's life expectancy sits at approximately 83 years, one of the highest in the entire world, and that single statistic says everything about what this healthcare system delivers over a lifetime. Here's the honest trade-off though: wait times in the public system for non-urgent specialist appointments can stretch from several weeks to months. Northern Italy generally has stronger hospital infrastructure and resources compared to the south. And while English-speaking doctors are fairly common in major cities, rural areas can present a real language barrier. Most experienced American expats in Italy take a smart, blended approach, leaning on the SSN for core coverage and adding a private plan for faster and more comfortable specialist access. Together, the cost still sits well below what you'd pay for health insurance back in the United States. On the residency side, Americans need the elective residency visa, the ERV. It requires proof of stable passive income of at least roughly €31,000 per year for a single applicant or €38,000 per year for a couple, suitable accommodation, and private health coverage up front. It's not the lowest bar on this list, but here's what makes Italy even more compelling: the 7% flat tax regime. Foreign retirees who relocate to qualifying municipalities in southern Italy, regions like Sicily, Sardinia, Puglia, and Calabria, pay a flat 7% on all foreign source income for up to 10 consecutive years. For many Americans living off pensions and Social Security, that's a genuinely remarkable tax advantage. And the lifestyle? Italy ranks number 1 on the 2025-26 Taste Atlas Best Cuisines in the World. Living costs overall run about 30% cheaper than the United States. From the rolling hills of Tuscany to the sun-drenched shores of Puglia, this is retirement at its absolute finest. 4. Thailand. Thailand has been seducing retirees from around the world for decades, and when it comes to combining world-class healthcare with jaw-dropping affordability, very few countries on this planet even come close. Thailand's private healthcare sector is genuinely exceptional. The country boasts over 60 Joint Commission International accredited hospitals, more than any other nation in Asia except Singapore. Bumrungrad International Hospital alone treated more than 604,000 patients from over 180 countries in 2025 and ranked 96th in Newsweek's World's Best Hospitals 2026, the only Thai hospital in the global top 100. Bangkok Hospital, Samadij, and MedPark round out a roster of facilities that rival anything you'd find in the United States, but at a radically different price point. An outpatient consultation at a top private hospital runs just $20 to $50, and major surgeries or procedures are often done at 50 to 80% lower cost than in the West. A knee replacement that costs $30,000 to $50,000 in the US. In a leading Bangkok hospital, that same procedure runs around $12,000 to $15,000, typically including the hospital stay, surgeon fees, anesthesia, and aftercare. Dental care, cardiology, orthopedics, cancer treatment, the savings across the board are extraordinary. It's no surprise Thailand has long been one of the world's top medical tourism destinations. Thailand's life expectancy sits at approximately 80 years, a solid indicator of the overall health outcomes that quality private healthcare continues to support across the country. The trade-offs, though, are important to know upfront. Thailand's public healthcare system is largely inaccessible to foreign retirees, so you'll rely on private care, which means health insurance isn't just smart, it's required for your visa. Comprehensive international coverage typically runs between $1,200 and $3,500 per year depending on age and pre-existing conditions. Medical cost inflation in Thailand was projected at 14.2% for 2025, something worth factoring into your long-term budget. Healthcare quality is also heavily concentrated in Bangkok, Phuket, and Chiang Mai. Rural areas are a very different story. On the residency side, Thailand's OA retirement visa is available to anyone aged 50 and over, requiring either approximately $23,000 deposited in a Thai bank account or a monthly income of around $1,870. U.S. Social Security can qualify toward that income requirement. The visa requires annual renewal and mandatory health insurance, but the financial bar is genuinely one of the most accessible on this list. If you prefer something more long-term and hands-off, the Thailand Privilege membership offers stays from 5 to 20 years for a one-time fee. As for lifestyle, Thailand is the land of smiles for a reason. Bangkok is a cosmopolitan powerhouse with world-class dining, shopping, and entertainment. Chiang Mai delivers a cooler, more relaxed pace with a beloved expat community. Phuket offers stunning beach living with over 100,000 foreign residents. Living in Bangkok is about 57% cheaper than New York, and Forbes named 4 Thai cities among the top global retirement destinations for 2025. This is Southeast Asia at its very best. 3. Spain. Spain tends to sell itself on sunshine, tapas, and culture, and that part is absolutely true. But what doesn't get nearly enough attention is just how extraordinary the healthcare system is. For American retirees, that matters more than the sunshine. Spain's national healthcare system, the SNS, or Sistema Nacional de Salud, covers 99.5% of all residents. Spain spends just $5,346 per capita on healthcare, below the OECD average, yet consistently delivers better outcomes than countries spending far more. Preventable mortality in Spain sits at just 92 per 100,000 people, compared to the OECD average of 145. Spain also has 4.4 practicing doctors per 1,000 residents, well above the OECD average of 3.9. The result? A life expectancy of 84 years, the third highest in the entire European Union and nearly 3 full years above the OECD average. That is a healthcare system operating at an elite level, and the numbers prove it. Now here's how it works for American retirees specifically. You can't tap directly into the public SNS from day one, you'll need private health insurance to apply for your visa first. The good news is that Spain-compliant private plans are genuinely affordable, typically running between €50 and €150 per month. Once you're a legal resident, you can access the public system through something called the Convenio Especial, a paid-in scheme costing around $65 per month if you're under 65, and approximately $170 per month for older residents. That gets you full SNS coverage, hospital care, GP visits, specialist referrals, emergency services, and heavily subsidized prescriptions. Most experienced expats run both, private for speed and flexibility, SNS for comprehensive backup. The honest trade-off? Waiting times for non-urgent specialist appointments in the public system can range from 85 to 110 days depending on which of Spain's 17 autonomous regions you live in. Private coverage largely solves that problem entirely. On the residency side, the non-lucrative visa is the primary route for American retirees. It requires proof of passive income of approximately €28,800 per year for a single applicant, roughly $32,000, along with private health insurance, a clean criminal record, and proof of accommodation. Note that Spain officially abolished its Golden Visa program in April 2025, so the non-lucrative visa is now the main path. After 5 years of residency, you can apply for permanent residency. As for lifestyle, over 300 days of sunshine per year along the coastlines, world-class cuisine, vibrant cities, charming beach towns, and everyday costs that run about 34% lower than the United States. Spain ranks 25th on the 2025 Global Peace Index. From the Costa del Sol to Valencia to the Canary Islands, retirement doesn't get much better than this. 2. Portugal. If you've been waiting for the retirement destination that checks every single box, world-class healthcare at almost no cost, one of the easiest residency visas in all of Europe, a beautiful lifestyle, and a cost of living nearly 40% cheaper than the United States, let me introduce you to Portugal. Portugal's public healthcare system, known as the SNS, Serviço Nacional de Saúde, provides universal coverage to all legal residents. And here's what makes it especially remarkable for retirees. In 2022, Portugal abolished most user fees and co-payments under the public system. For seniors over 65, most SNS services are essentially free: doctor visits, hospital care, emergency treatment, and heavily subsidized prescriptions. The SNS is a genuinely solid system, particularly in Lisbon, Porto, and the Algarve, where English-speaking doctors are more common and hospital infrastructure is strongest. And if you want faster, more personalized care, private health insurance in Portugal is remarkably affordable. Comprehensive private insurance typically costs €100 to €250 per month per person, or as little as €15 to €20 for a basic policy. Private hospitals like CUF, Luz, and Lusíadas in Lisbon, Porto, and Faro offer excellent care with English-speaking staff and appointments available within days. Portugal's life expectancy has risen to approximately 82.8 years, solidly above the EU average, a strong reflection of what this healthcare system delivers over a lifetime. The honest trade-offs: waiting times in the public sector remain a real challenge, with over 30% of patients waiting more than 3 months for specialist appointments. The best hospitals and specialists are concentrated in Lisbon and Porto, while rural areas have more basic facilities. Dental care is also generally not covered under the public system for adults. Most people budget separately for private dentists, though costs are still very affordable by American standards. On the residency front, Portugal's D7 passive income visa is one of the most accessible retirement visas in the entire world. In 2026, a single applicant only needs to prove passive income of €920 per month, roughly $1,063, to qualify. U.S. Social Security counts directly toward this requirement. You'll also need private health insurance, proof of accommodation, and a clean criminal record. After just 5 years of legal residency, permanent residency is yours. As for lifestyle, Portugal is simply stunning. The cost of living in Portugal is 39.2% lower than the US, and rent is 54.2% lower. The Algarve offers some of Europe's most breathtaking coastlines. Lisbon and Porto are vibrant, walkable cities full of culture, cuisine, and warmth. The people are genuinely welcoming, the climate is mild and sunny, and Portugal consistently ranks among the safest countries in Europe. It's no wonder this is one of the most sought-after retirement destinations in the world right now. 1. France. France's national health insurance program, Assurance Maladie, operates through a universal access framework called PUMA, Protection Universelle Maladie. After just 3 months of legal residency, you can apply for PUMA, which covers approximately 70% of most standard medical costs. A GP visit runs €25 to €30. Specialist consultations operate on regulated government tariffs, geriatrics at €37, neurology and psychiatry at €52. Prescriptions are heavily subsidized. The reimbursement process is also remarkably seamless. Present your carte vitale health card at a doctor or pharmacy, and within 5 days, your reimbursement lands directly in your bank account. To cover the remaining 20 to 30% gap, most residents add a mutuelle, a supplemental insurance plan, which typically runs €50 to €150 per month for retirees. A retired couple living in the south of France might spend as little as €90 to €150 per month total on all healthcare costs. According to 2025 OECD data, France's life expectancy stands at 83 years, nearly 2 full years above the OECD average, and preventable mortality sits at just 114 per 100,000, well below the OECD average of 145. These numbers reflect decades of investment in a system that genuinely treats healthcare as a fundamental right, not a privilege. Now here's a critical 2026 update American retirees absolutely need to know. France's new Social Security financing law introduced a mandatory annual healthcare contribution for non-EU visitor visa holders, estimated between €300 and €600 per year, required before you can receive your carte vitale. As of mid-2026, the exact amount was still pending a government implementing decree, so private expat insurance remains the practical bridge for now. CPAM registration also takes 3 to 9 months to process, so starting early is essential. And on taxes, France's income tax is progressive up to 45%, which means consulting a tax specialist before relocating is strongly advised. On the residency side, American retirees typically use the long-stay visitor visa, the VLSTS visitor. As of January 2026, the minimum income requirement stands at approximately €1,443 net per month, roughly $1,570, tied directly to France's national minimum wage. Private health insurance, proof of accommodation, and a clean criminal record are also required. And the lifestyle? World-class cuisine, legendary wines, the sun-soaked Côte d'Azur, Provence, and Paris. Comfortable retirement living for a single retiree runs roughly €2,000 to €3,000 per month. If world-class healthcare wrapped in one of the world's greatest cultures sounds like your ideal retirement, France makes an absolutely compelling case. There you have it, the 8 countries that can offer world-class healthcare at a fraction of the cost of the United States. There are also other countries, such as Germany, Taiwan, Singapore, Denmark, Switzerland, Norway, and New Zealand, that offer healthcare systems that are just as good as, or even better than, those in the US. In some cases, healthcare costs are lower as well. However, access to these countries for retirees can be more complicated, and the overall cost of living is generally higher than in the countries featured in this video. Still, you may want to consider them if you have a pathway to relocate there and can comfortably afford the cost of living. Thank you so much for watching this video. If you found it helpful, don't forget to like, share, and subscribe to the channel. Also, let us know in the comments which country you think offers the best healthcare at a lower cost than the United States. And if you think we've missed anything or need to correct any information shared in this video, feel free to let us know in the comments section. We'd love to hear your thoughts. While healthcare is one of the most important factors to consider when choosing a retirement destination, it's not the only one. Safety is equally important and should never be overlooked. After all, there's little value in having access to excellent healthcare if you're living in a country where your safety is constantly at risk. In 2026, several countries that are still being recommended in retirement articles and videos are no longer among the safest places to retire. Check out the video appearing on your screen to discover these countries and learn which destinations you may want to avoid as you plan your retirement abroad.